What? Yeah, do it.
Oh.
I got your name. So, all right, go ahead.
Okay. Hi, I'm
Hi.
Scott. I'm a student pharmacist here at Drake University. Today I see you have a new prescription from Dr. Jones. Looks like it's just a new one. Today we're just going to be talking about the medication here. Make sure it's safe for you. Can I just verify your name?
My name's Maria.
Maria. I actually have a different prescription here for you. And you said your name is Maria. I have one for patient Mr. Stark. What's his birthday?
4/22/74.
4/22/74. Do you know Mr. Stark? Or
That's my husband.
Your husband. I
Mhm.
see. I see. Okay. So you're picking up his medication today?
Apparently.
Apparently. Okay. So were you with him today? Are you aware of what the medication is, what it was for, or his doctor's appointment?
I was not there, but he's too embarrassed to pick it up, so here I am. So,
I see. Okay. So, do you know what so I have the Cialis here for you. It's a brand name prescription. Did the doctor tell you guys what it was for, or how you're supposed to be using it?
Yeah, it's to improve our sex life, apparently.
Okay, so you guys are aware of that. So this can be used for erectile dysfunction.
Mm-hmm.
It's commonly used for. So it looks like he's got the 10 milligram tablet. He's just doing one tablet, just as directed, really as needed. Usually about a 1 hour onset, so just about an hour before intercourse, you can use it. It can last up to 36 hours, so just make sure you guys are aware of that when you're using that.
Okay.
So he's doing it one there. He's got 0 refills on there, so I think you're just trying it out, probably.
That would be my guess, yes.
Okay. So just trying it out, making sure it works, see if it's safe. Did the doctor tell you guys any of the side effects, what to look for with this one?
I don't know, I wasn't there.
Okay,
so.
it wasn't there. Okay, so some of the side effects with this one, it can cause a headache, flushing of the skin, nasal congestion. So if he has a lot of that, we can kind of look into products to help him if he has some of those side effects. I see he has also taken the amlodipine for his blood pressure, because he has a history of hypertension. These two combined can cause some hypotension, so low blood pressure. Just make sure you're aware of that too. Make sure he's careful when getting up out of a chair. He can be dizzy. He has something to hold on to, especially when he gets up. Just make sure it's slow when getting up too. One of the more severe side effects is an allergic reaction, so just make sure you check for that. It usually occurs after about the second dose. So, all right. Is that all making sense to you?
Well, is this it's going to affect his blood pressure all the time?
Only when he takes it. So it looks like he just takes something already for his blood pressure. When he does take the medication, it could cause his blood pressure to drop a little bit.
Okay.
So just make sure if he's starting to get real dizzy, lightheaded, that's when he'd want to slow down, have a seat, maybe drink some water.
Okay.
Okay. All right. Good question. Thank you. So he's just doing it as directed, so there really is no missed doses with it. You want to store that at room temperature, away from light, heat sources, in a dry area. Usually a cabinet kind of high up on the shelf is good, so that way children don't get in or anything like that.
Mm-hmm.
That would be unfortunate. What other concerns do you have with the medication?
Is this common? I mean, do a lot of people take this?
Yeah, I mean, it's a pretty common.
What causes it?
It can be a lot of different causes with that. It could be physical causes, like if he had a previous injury. I don't see that he's had any previous injuries or anything like that. With age, the chance and development of erectile dysfunction can increase as he gets older. It can even be about 7% of individuals 20 years old could have erectile dysfunction also from the latest data. With that, so as you get older, it can happen. It can be just a psychological issue that could have occurred. I'm not completely aware of what caused it. I don't know why the doctor gave it to him. So yeah, that can be a concern with this medication. So just doing it as directed. So some of the key points that it could cause, like a headache, flushing the skin, hypotension. He's just doing it one tablet as directed, as needed, about an hour before intercourse. So make sure you guys are just aware of that before you use it. It can last up to 36 hours.
Okay.
So those are some of the longer lasting effects with it.
Okay.
Any other questions?
No.
Okay, excellent. All right, well, thank you guys.